Hi, I'm Dr. Caroline Redpath, the clinical supervisor for the River Street Outreach Program. I know as parents, we're all nervous about the impact of COVID-19 on our children's health and on their educational program. Our goal as parents is to keep them safe and minimize the impact of this health crisis on their lives. We can do that by giving them simple information and teaching them behaviors that will keep them healthy and safe. Schools have been closed now since March. We know that our children are greatly impacted from the shutdown. They have been separated from their schools, friends, play dates, excursions, and everyday activities. We want to bring them back in a safe and thoughtful manner. We've researched factors related to a successful return, combining information from the CDC, educational authorities, and from providers across the country. From this, we've been able to identify key areas related to a safe and successful return. COVID-19 has changed our world and our schools in ways we could never have predicted. We don't know what the future holds. We must be poised to be flexible. We may be looking at closing, reopening, closing again, with students having to flex between program models. The more skills we can teach proactively, the fewer problems we will encounter later. The risks that your child faces as schools reopen are threefold. Some children have increased risk due to pre-existing medical conditions. You as the parent, along with your child's healthcare provider, will have to weigh out whether or not the child's medical risk factors are greater than the risk of losing educational ground. Risk factors might include having a respiratory disease, heart condition, type 1 diabetes, or being immunocompromised. Other risk factors are determined by how well your child can follow safety and hygiene recommendations, their level of self-help skills, and their ability to exhibit behavioral control. Skill gaps in these areas can also put your child at risk. The purpose of assessing these skills is not to keep kids out of school, but to identify those factors that need to be a part of the teaching process prior to return. We can't assume that our children know how to do these skills. We need to teach them. It's okay if they don't have all of the skills. Finding out about skill gaps enables us to identify issues that will need to be planned for through updated safety plans, environmental arrangements, staffing, and program models. A student behavioral assessment is the next step. This is where outreach staff can assist districts in targeting where a student is in skill development. Outreach staff will assess the student through interview with parent and student and by virtual observation. A report will be generated as to the child's status in each area with specific recommended strategies for addressing these skills. Skill training can then be provided by district staff or through contract with outreach staff. The following areas are assessed: the child's ability to comply with safety rules, their hygiene skills, their emotional regulation skills, their current adherence to daily routines, their learning history during the shutdown, any behavioral issues that are being exhibited, and the feasibility of continued virtual instruction. Mask wearing is important as it gains access to public places. Let your child get used to wearing a mask. Fabric masks are recommended. There are many different types of patterns of mask. Finding a mask that your child really likes will increase the odds that they will wear it. Let them practice keeping the mask on. Reward them for increasing the length of time that they're able to keep it on. Start now so that by the start of school, mask wearing is easy for them. Some children are not going to be able to wear masks. If this is identified, the team can then arrange for alternative protection for those working with the student and can adjust safety procedures. It is also important that the child tolerates seeing others wearing masks. This can be scary for some children. We'll want to familiarize the child with seeing familiar people wearing masks prior to the start of school. Social stories about children and adults wearing masks may be helpful. Temperatures may be taken in some schools or classes upon entry. This is another skill that can be practiced ahead of time. You can simulate this by using a large spoon and holding it up to their forehead if you don't have a scanning thermometer. Children may need to wait in line to have their temperatures taken. In doing so, they cannot clump together or walk away. Having practiced this skill is helpful. Social stories may also help. If your child does become sick at school, they're going to be asked to wait in an isolated area in order to contain any germs. It is important that your child learn a method of entertaining themselves while waiting for you to pick them up. This may be using a small electronic device, looking at a book, using a simple task completion toy, or a fidget. Find out from your school what directional visual symbols they plan to use. If they use arrows in the hallway to indicate direction, practice following arrows in your house so that they can learn that a right pointing arrow means to walk to the right. If they're going to use taped X's on the floor to indicate places to sit or stand, use the same thing at home. Make a game of finding the X and having them stand or sit on it. If they're going to X out seats in the classroom, do that with chairs at the dinner table. It's important to introduce these concepts and to practice them. Having strong self-help skills reduces the need for staff to have repeated close contact with the child during the school day. The more independent a child can be with toileting, dressing, and feeding skills, the less risk of contact exposure. Time in virtual learning can be spent prioritizing these skills. If the child has motor difficulty, these are strong objectives for occupational therapy. School lunch will be different this year. Children will be eating in their classrooms. The more independent a child is with lunch containers that are sent into school, the less chance they have for exposure to someone else touching an item that's going to go into their mouths. Parents should begin thinking about the containers that they plan to send in and work with the child on how to open them. Practice opening various types of containers: Ziploc bags, juice boxes, Tupperware type containers, chip bags, tear-off containers such as condiment packets. Hygiene skills, like safety skills, can be taught prior to the restart of school. Skills such as covering a cough or sneeze with their elbow, using a tissue, how to properly wash their hands are essential. Let them help you wipe off a surface, as they will be asked to wipe off desks prior to using them. Learning how to wipe down materials is useful as well. Children will be asked to wash their hands multiple times during the school day. Practice sessions at home, having them wash for at least 20 seconds, will help prepare them. Some children need a reminder, such as singing happy birthday twice, to remember how long to wash. Practice with them so that they wash the tops, bottoms of their hands and between their fingers. They also need to know how to dry their hands. Sometimes they'll need to use hand sanitizer instead of washing their hands in a sink. Tolerating the texture of hand sanitizer is hard for some children and may take some practice sessions. There are emotional regulation skills that are important to assess, as they may indicate the types of situations where we can anticipate problems. They're issues that we see particularly with children on the autism spectrum, but also with other conditions as well. These require more specialized treatment, but practice sessions in tolerating small doses of frustration and change can help develop new skills. Rehearsing ahead of time what to do when someone else breaks safety rules will help avert a meltdown, but will also help calm the fears of the child. These skills could be addressed ahead of time by school clinical staff, such as your district BCBA, social worker, school psychologist, or could be contracted through our CREC outreach staff. We know that daily routine sets the stage for a successful day. Children are out of their normal routines during the shutdown, and it will be important to build those back up during the summer. Establishing a daily routine at home will help with transitioning back to the school routine. Get your child used to a consistent bedtime and wake-up time. Because of the challenges parents are facing in trying to work from home as well as having their child at home, children are spending more time in self-selected activities and using electronic devices. It will be important that they begin having demands on their time to complete scheduled activities that are not of their choosing to prepare for teacher demands. For example, putting in a gradually increasing expectation for chores at home will promote your child getting used to following demands again. If your child has had problem behaviors increase since the coronavirus shutdown, It's important to contact your school to have a BCBA assist you in reducing these behaviors before school starts. Increased behaviors may bring increased risk for your child due to the necessity of staff intervention. Although behaviors are likely to look a little different from home to school, if a child has been experiencing increased behavior problems, particularly aggression, self-injurious behaviors, destructive behaviors, or elopement, the school will need to be prepared to set up alternative safety plans to safely handle those behaviors. Having this information now will help your team and your BCBA or contracted BCBA plan for serious behaviors. There may be some students or situations where continuing virtually is advised. It is also likely that schools may have to move back and forth between live and virtual learning if COVID levels increase again. Prepare your child for the possibility of change. In the meantime, if your child struggles taking instruction from the screen, practice this with simple instructions to do things that lead to reinforcement. For example, communicate between a phone and a tablet to tell the child to go to the table and have a reinforcer available on the table. From this assessment process, we will provide a status report as to where a student is on the skills checklist, identify gaps, and target behaviors to teach during the summer. We will make recommendations as to strategies that can be used in teaching these skills. From there, the district and you, the parent, can take that information and begin to teach and plan for your child's transition. With all of these skills, it's important to provide reinforcement while the child is learning and for following the rules when back in school. These skills are absolutely crucial right now and should be a learning priority. Transition planning should include the familiar components of meeting the teacher, seeing the classroom, and knowing the expectations ahead of time. This may need to occur virtually this year, but should not be forgotten. Ask your child's school if you and your child can meet virtually before school starts. Ask to have the visit into the classroom so that your child can see what to expect. This also gives you the opportunity to know what types of cues your child will need to respond to. We want your child to be prepared for the changing demands of school attendance during a pandemic. Some of these skills are easily taught by parents in the home. Others require slower steps and oversight expertise. If you find that you need our assistance, our staff can assist in assessing your child's skills and can set up a skills learning program for your child through a contract with their school.